All right. Thank you, everyone, for joining. My name is Daniel Spohr, and I'm the founder of ChartFlow. And today I'm incredibly excited to show you all our brand new simulation control panel, which really is, the culmination of our team's last decade working with simulation centers across the country and even across the world. And, it's been about 2 years that we started working on ChartFlow, and it's been about a year since it's been released, and 6 months of development specifically with this simulation panel, which I'm going to show you all today. So what I first off want to mention is why we built this panel. Really, the request that we've gotten over the years is for a number of things, such as being able to drop things in real time, orders, labs, a discharge, a note, things you've pre-built or things you just decide during simulation that you just want to add as it comes up. Maybe the students decide to do something you didn't expect, they go off the rails, and you go, okay, let's roll with it. Let's add that in. Or maybe things go according to plan and you've pre-built everything and you add in the labs and the orders that you expected. So we wanted to take that piece, and then we wanted to take this other piece, which was the time control. And this was something we put a lot of thought around of how could we pause time, how could we start time, how could we easily reset the clock, both for new groups, for new days, if you're using it for interprofessional education, kind of all of the above. So this is where simulation control panel came from, and I'm going to share my screen now. What I'm going to do here, we're going to go pretty quickly in this webinar. We're going to probably go about 25, 30 minutes, no more. We'll take questions at the end. Feel free to chat, and I'll answer those towards the end. That way I can just be on a roll and show you everything I want to show, and we'll cover all the Q&A towards the end of the call. What I'm going to do is I'm going to show you the panel, tell you how it works, what functionality to expect, the things that we have in it today. We only released this feature about 2 weeks ago, right before we attended IMSH. And so there's a number of updates that we're planning over the next 6 months, improvements, additional capabilities that I'll talk about. So all of that will be things we'll cover. And then, of course, I'll show you how you can set this up. If you have an account today, if you're using ChartFlow, if you're already a customer, or if you just have a demo account, this is available today in everybody's portal. There's nothing that I need to do for you to turn it on, and I'll show you where you can access that. And so without taking any more time, let's get into it. So if everyone can see my screen, you'll see the homepage here, which anybody who's used ChartFlow is used to our homepage. And what's new now is next to the simulation activities, you have a simulation control tab over on the right. And so this will get into the simulation control panel. And that's going to allow me to then start the simulation. Let's go ahead and start the clock at 12 o'clock. And we're going to say this is my webinar simulation. And let's go ahead and start that. And so what this panel is it's designed to be used in a control room where you as an educator are sitting in your control room, the students are on the other side. And so you will see this panel right here on your screen. For students, what are they going to see? Well, if I switch over to just another tab in here, they're going to see the same activity dashboard that they normally see in normal activities, the same patients and everything else. But they'll get a lot of real-time updates and functionality, which we'll talk about with messages and events that you may be releasing. And so what this panel allows you to do is a few things. First of all, patients that have pre-built events, such as lab results, such as orders, such as discharge, such as vital signs, and I'm just going to reload the screen just to make sure everything goes smoothly here for the webinar. Any events that are pre-built, you'll see right here with this little event button. You'll also see any users that are connected to the simulation down below as well. Later on, we're going to add functionality to be able to add students, to remove students. There's going to be different device support, which we'll talk about later. So that's coming soon. But right now, what we have, first of all, I think the most important part here is this events piece. And these events Can be anything. They can be labs, they can be an order for dilaudid, they can be a discharge, new vital signs, discontinuing medications. Any documentation, any part of the chart that you've pre-built can be an event. And you'll see if the patient has it, you'll see that event toggle in there, and you could click on the event, drop it in, and you'll get a message over at the top right saying the event has been added successfully. And then you'll get a second message right here that the patient has been updated. And if we click on that, that'll actually take us directly into that patient, which is really nice for students that happen to be in the simulation working with you on the same scenario in real time. So they'll get notified in that way where you don't need to tell them, you don't need to shout it across, you don't need to call it in an intercom or anything like that. Just use ChartFlow and the system will notify them over in the top right. Same thing if you just decide to do something on the fly. Let's say you go, I'm going to go in here and add a new entry, a new note. We'll just type in the words new note, hit save. Same thing, we'll see at the top right, both the note save as well as a little message that it's been updated. So all of this happens in real time. I think this is definitely probably the most important feature we have on the panel, certainly one of the most complicated for us to have built. And that's going to allow you again to drop in all of that information in real time. And again, students, as they're documenting, you'll be notified on your panel here. So it goes both ways. As an instructor, you're adding information, students get notified, students add information, you get notified. And all of this works on all devices. So you don't need to be in a laptop or a desktop. You can be on a phone, you can be in a tablet. It'll work on any device that's capable of running ChartFlow, which is pretty much any modern device with a web browser. So that is the event piece. Now, then, of course, there's a number of other features here with the time control. So you'll see that I started the simulation at 12 o'clock, a little 5-minute difference from the local time that my computer is set at. And you can start your simulations at any time, and that will force all of the patients into that exact time. So if you want to run your morning simulation at 12 o'clock and then you want to do your afternoon simulation at 3 a.m., you can do that. And what's great about this is that you can pause the clock at any moment. So if you have a teachable moment, maybe there's an outage, electricity goes out, internet goes out, maybe someone just needs to go to the bathroom, a question pops up, anything, you can pause that clock. But a really nice way to use that pausing feature is for interprofessional education, where if you, let's say, have your nursing students using the system in the morning, and maybe your physician assistant program or your respiratory students, your medical students, or anyone else is going to come in the afternoon, and you want them to join the same simulation, see the same patients, and take over where your morning group left, you can pause that sim, wait a couple hours, everybody goes to lunch, we come back, and then we resume it, and the clock starts off right at the same time. And so that way, just like a movie, just like Netflix, you can pause it and then resume it whenever you want. So the time control features are really useful. You can take it a step further and you can advance time. Now, we can't go back in time. We thought about this and we couldn't come up with a reason of why you would want to rewind. I would love to hear if anybody had a scenario. We did talk to a number of schools and no one could come up with one. So we only built the ability to jump time forward, which I think makes the most sense. And so we call them time warps, where you can warp time by minutes, hours, days, weeks, months, or years. And so if I go ahead and say, hey, let's warp this by 1 hour, hit warp time, it's going to do exactly what you expect, advance that clock at the top by an hour. And if I just quickly switch back to my Google Chrome tab where my student is, there we go. Now they're at 1:04 p.m., just like my instructor panel is set up. So that is really fun when it comes to newborns, when it comes to your pediatric patients, where maybe you want to go through 2 years of a patient's life in an hour of a simulation. You can do their birth, you can pause, you can resume, you could say, hey, let's do 3 months advance, bring that baby back, release some events that we've pre-built, some new notes, some new vitals, some new vaccines that have been given. And Here we go. We continue. Now the baby's back. They're 3 months old for their follow-up visit. Advance another 3 months. Now they're 6 months old. Advance another 6 months, and now they're a year old. And you can kind of go through a year of a child's life in an hour, 2 hours, 30 minutes, as long as it will take. And so that warping feature is really useful as well. Now, the final feature, I think, arguably could be more important than the event feature because it allows you to set up your simulation once and run it multiple times throughout the day really easily. So we've always been asked, can we clear out the patient charts? Can we reset charts? And this is our solution to that, is this reset feature. And what this does is you hit the reset, it basically kicks everybody out. It saves them, right? So here we are. If we go back into this drop down, we give it a second to load. We'll see all the runs I've done. I had a few that I've been using at IMSH throughout the conference. What was that? About a week ago, 9 days ago, initially when I was testing it. And then, this webinar simulation I'm doing here today. And we can see the different students that are attached to each of those simulations. My demo student that's attached here, myself. If I go into this number 4, this was one I did with Mount St. Mary's in California. Shout out to them for our training last week. And, so on and so forth. We can go back and see other simulations that I've done with our internal team and IMSH and so on and so forth. And so this again allows you, if you run the same simulation multiple times a day, maybe you run it 8 times a day, 4 times a day, you build it once, you set up that activity, you run your morning group, you're done, you hit reset simulation. Let's go to new simulation. And now we can start a brand new sim and say, here's my webinar number 2, start sim, and we get fresh patient charts for our new group. And we can verify that by going in patient chart, and we'll see the note that I added is no longer there, and the patient is back to its original template form. So this is what we have today for the simulation control panel. This feature sits on top of our EHR, and that's how it works. And what is going to happen next is we have a few schools, just a couple, that are currently beta testing it with us, that are using it. We actually had one school in Ohio, Road State College, shout out to them as well. Just a few days ago ran their first simulation and things went well, I heard, and they had some positive feedback for us to improve the panel, some quirks to clean up and make it even better. So for anybody that would like to try it, like I said, this is available in your account today, and I'll show you how to set up those activities in just a few minutes. What's coming tomorrow, though, and by tomorrow I mean over the next few months, with this panel, is first of all the ability where you can manually add students. These are dead buttons right now, they're just placeholders. You can't remove, you can't add students today, but in the next couple months we're going to make these functional. What we're also going to do is add another section here at the bottom for devices. And what that's going to allow you to do is, if you have, let's say, a workstation on wheels, you want to go ahead and say, okay, this computer will run Robert Gomez. You set that up beforehand on that computer, and then any student that logs in automatically goes directly to that patient, and you can kind of see which devices will be locked to which patients. It's a little bit advanced, a couple months, and probably summertime we'll get that in there, maybe even sooner, depending on how much folks want that feature. And from there, it's just going to be improving the functionality of this, the real-time connectivity, and also the messaging. We've been getting a lot of requests about these messages that pop up in the right. We'll see if it shows up here now that I started a new sim. Here's that blue message. One of the requests we get is that right now the message disappears after 10 seconds. Pretty much every school has told us they don't want that. They want the message to stay there and have students identify it, check it off, right? That they've accepted that new information before it disappears. So that's something we're considering. I think that makes a lot of sense, and I think that mimics a lot of the functionality you'll see in the real systems that are used in hospitals as well. So as you're using the system, please let us know any feedback, any ideas that you may have for us. So What I want to show you next is how I set up this panel, how you can actually use this, um, where this lives. And, we want to keep things as easy as possible in ChartFlow. We don't want to create dozens of screens and, complicate the user interface. So if you're already using the system, you're going to find this to be really easy. This is going to be within your course, whether you built a new course or you have an existing course. You're going to go to Manage Course here at the top right, and you're going to want to create a new activity. And where this simulation panel lives is under the second tab. So let's go ahead and say, this is my webinar activity. And if I click into that experience tab, you'll see, of course, the original options we've had since our launch, the new patients where students can create their own patients. That's great for skills lab. That's great for your clinical assignments, anywhere where students are going to build their own charts. Your template patients where you can add pre-built patients from the library, either individually for students to access or in a group or shared setting where everybody gets the same patient scenario to use as they would in a real clinical setting. And then, of course, the simulation is the third experience. So this is just a new activity type. That's all it is on our back end. And when you select that, there's a couple options you have that I'm glad it showed me because I forgot to mention. First off, you can allow students to preview the simulation beforehand. And that's useful because you may want them the night before, maybe the morning of, to just get in there, poke around, look at the orders, look at the notes, the vital signs, get acquainted with the scenario before they begin simulation without starting the clock and without forcing you to reset the patient. So that will allow you to do that. It'll allow them to preview those patients on their own time. You can also not allow that, and then they won't even see what patients exist until you actually start the sim. From here, you just want to add your patients as you add patients to any activity. So let's just add one patient in here. Of course, you can add one patient, you can add multiple, 3, 5, 10, 50. The most I think I've seen a school add so far is about 30 or 40. But in theory, it should scale as much as you need. Uh, yeah, feel free to add as many patients as you want to one of these activities. And I should note that simulation activities are by default shared. So everybody in the simulation will access the same instance of the charts as you would in a hospital. So students that leave a note, all of the students will see the note. Someone leaves vital signs, everybody sees vital signs. And everyone that's a part of that simulation run. So if you've reset the simulation and you made a new simulation run, even if you're using the same activity, now it's new instances of the patient. So keep that in mind as you're using this control panel. And from there, everything else is the same. Your visibility settings, your student instructions, your instructor description. The rest of the page is exactly as building existing activities. It's really just make sure you select the simulation activity, decide whether you want students to preview the patients or not, add your patients, hit save, and it'll set that activity up for you. And you've done it correctly because it'll say simulation. If not, if you made a mistake, just build a new activity. Once you've saved it, you can't change that experience, but it's no big deal. It takes a couple seconds to build a new sim. And of course, you can use the same patients in multiple activities. So if you want to add this patient to a template patient activity, and then you want to add them to a simulation activity and another template patient activity, multiple courses, that's fine. You can use them as much as you would like. And you've done it correctly as well because on your homepage, you will see next to the activity on the far right, the simulation control button right there. Click that and you'll be taken right into the panel that we saw earlier. One other new little thing that I really like in this update is if you add a lot of patients to the activity, it now organizes them a little better on your homepage. It will wrap them. So before you had to scroll to the right, I don't know how everybody else felt. I found it a little annoying. And so thank you to our development team for that update as well. Just makes the homepage a little nicer, especially if you've added 20, 30 different patients to the activity. Now, the final thing I want to show you is where the events live, how to build those events, especially. Those are going to live on your patient templates. And so any template can have events. If I go in here and edit a patient, we're going to now see a new event button right here at the top. And so this event button will live on any patient in the system, but those events will only be, so to say, activated or available for you if you've created a simulation activity. So you build them in your templates, you go to events, you hit new event to build the event. You give the event a name it anything you want. Let's say you want to say, new vital signs. Put a description in there for yourself. Students don't see this. Remember, these are suppressed. These are just for you and your other instructors and faculty and your SimOps team. So, you want to say new vital signs showing positive progress. Maybe you want to make a little note what the vital signs are. Anything, just a little reminder for yourself what's in there. Save that, let it refresh and kind of go through its cycle before you do anything else. And you'll know you're in the event because you'll get this green bar. We try to make it really obvious that you're in an event. So when you're in an event, you just document as you would on a normal patient template. Add a new entry and document accordingly. One suggestion I have to keep things very simple is keep the dates and times as a 0 minute before start. So that way, when you release the event, it looks like it just happened immediately. If you do something like 5 minutes before start, it just could get a little complicated where you release it now, but it looks like it happened 5 minutes ago. You could do that. Just be aware when you make that decision that will show up looking like the event happened in the past. To keep things really easy, just keep it as a 0 minute before start. Hit save and that'll save that piece of information and tie it to the event. And you can put one piece of data in the event. You can put multiples. So if you wanted to put multiple sets of vitals or multiple orders or multiple medications or multiple notes or anything, you can do that. Or you can make one event, one order, one event, one vital sign. So it's up to you. Do you want to release a whole order set? Do you want to release a whole set of labs? Do you want to release multiple sets of vital signs, maybe an hour ago, 20 minutes ago, 30 minutes ago, 10 minutes ago, right now? Or do you want to just release that one piece of information? Exit the event and you're all set. Nothing else to do. And you'll see the events living right there. And then those will be available for you in the simulation control panel. So just make sure you've built your templates and have your events looking the way you want. Make that your first step. Then set up your activity. Set up the activity experience as a simulation control panel activity. Add the patients, and you're good to go. And that's really everything I wanted to cover. I'll take questions now. I will, of course, tell you all that this feature is so new that we don't have help articles for it. We will soon, probably in the next week or two. Our team's working on them and we'll probably have them released here before middle of February for sure. And they'll live in the instructor side. We're going to update the patient template section. We're going to update some of the other areas as well where that's relevant so that, you don't have to talk to myself or our team if you don't want to. You can reference the help site and see how that all works. So that's all coming soon. But I wanted to do this webinar first today to get this in the hands of everybody because I know we probably have at least a dozen programs that have been waiting for this feature for a few months at least. And so wanted to announce it, show you all how it works. And yeah, I hope you all are as excited as I am about this feature. And that's really everything that I have to cover. So I'll hang around, answer any questions. If anybody would like a one-on-one, a personal demonstration, a training, feel free to email myself, Daniel@chartflow.io, or at our team, hello@chartflow.io, and we'd be happy to help. So I will just go ahead and put that general email in the chat for you all. Let me make that available to everybody. And that's about it. So thank you all again for joining. Please let us know any feedback you might have as you're using this new feature. Did you like it? Any new features you'd like to see? How were the real-time capabilities? Were students getting notified? Those are all the things we would love to hear about.